We love dogs. We tolerate their breath. But we know bad breath isn't just a nuisance. It can be a sign of canine dental disease. Sure, daily brushing to keep teeth clean is ideal, but getting a dog to cooperate can be a real challenge for many pet owners. Greenies, dental treats are vet recommended and clinically proven to promote oral care when used daily between professional cleanings. Plus, they're irresistibly tasty and VOHC accepted for plaque and tartar control, with a texture designed to clean teeth effectively with every chew. So if you're looking for a routine they'll actually stick with, Greenies dental treats are the perfect place to start.
Welcome to Veterinary Vertex, the AVMA Journal's podcast, where we delve into behind-the-scenes look with manuscript authors. I'm Editor-in-Chief Lisa Fortier, joined by Associate Editor Sarah Wright. Today, we're discussing supplement use in dogs with repeat podcast guests Janice O'Brien and Audrey Ruple. Janice and Audrey, thank you for being here with us again today.
Thanks so much for having us.
Yeah, thank you.
Yeah, thank you for joining us, Janice and Audrey.
Janice, let's start with you. What question or problem were you hoping to address with this study?
So this one was kind of trying to be the first broad strokes overview into the Dog Aging Project's supplement questionnaire, and kind of looking at what are the most common supplements that are being given within the Dog Aging Project, what types of dogs are receiving these supplements, and who are the owners who are giving them, and kind of all those sort of questions, just trying to frame the things.
Yes, it's such an important topic. I have friends that are texting me all the time about supplements. I'm always saying, talk to your veterinarian because they know your pet better than I do. So, Audrey, why is supplement use an important topic to examine in companion animal medicine right now?
Well, we know that supplement use for companion animals is a rapidly growing market, and it's something that has consistently been growing over the last decade or so. And we think that's driven by pet owners' interests in preventive care and promoting longevity in their animals, but also for quality of life for their companion dogs. But at the same time, supplements for animals aren't regulated in the same way as drugs are, and they're not required to demonstrate safety or efficacy before they come to market, but they're often marketed in a way that really uses medical language. And so that disconnect makes supplement use a really important topic for evidence-based discussions.
Yeah, that can be tricky language to navigate for sure. Audrey, for listeners, you mentioned a couple times, for those who might not be familiar, what is the Dog Aging Project and how does it support research like this?
Yeah, the Dog Aging Project is a large longitudinal community science study that follows companion dogs located all over the United States, the continental U.S., and Hawaii and Alaska as well, and really studying these dogs over the course of their lifetime. Owners contribute detailed information about their dog's health, diet, environment, behavior, and also veterinary care and health outcomes through a set of structured surveys that are repeated every year. So what makes this project unique is the scale and diversity of it, which makes it really a great opportunity to study questions like the one that Janice had about supplement use.
I think for me, the most interesting or useful part of the DAP data set is that it is entirely owner-reported data. And so there's other types of data sets like, sales data or all those sites. But you don't necessarily know how the supplements are being administered, whether it's like a daily or occasional use kind of thing, and which types of dogs are actually receiving them. So the owner-reported data aspect of this, I think, is really useful.
At a very high level, Janice, what did you learn about common supplement use amongst dogs in this study?
So in this study, supplement use was really, really common. 52% of dogs were reported to be receiving a supplement of some kind. And I mean, I do think it's important to contextualize that the Dog Aging Project is, basically consists of dog owners that are voluntarily completing these very long surveys about their dogs. So, this population is special and may not be generally representative, but it was still, to me, kind of crazy. I was like, wow, that's over half of dogs that are receiving some sort of supplement.
Then going back to Audrey for a second. Audrey, what are some of the owner factors and the importance of studying supplement use patterns?
Well, I think that that's a really important context to remember with the dog aging project data is that we not only are collecting information about the dogs, but we also have owner reported data about themselves. And so supplement use obviously doesn't happen in a vacuum when it comes to supplementation in our companion animals. It's shaped by how owners perceive their dog's health, aging, their needs. And that's something that this data set really lets us to start unpack.
And Janice, what types of supplements are reported most often?
So among the ones that we asked about, the most common ones were actually omega-3 fatty acids, and then followed next by glucosamine, chondroitin, and then probiotics as kind of like the top most common supplements.
Actually, my cat is taking a supplement. First time I'm diving into supplements with my own pets. It was recommended by her internist, though. It's the only reason why I'm doing it. It's funny you say that because a component of it is omega-3. So she's been taking that for a year now. And it's funny. My husband's like, we're all taking supplements now, including the cats. I'm like, yeah, I guess we are.
Yeah, well, I come from the horse world, so saddle up. It only and then you learn, like, this one doesn't you can't open that one, and you can't leave that one open to oxidize, and so, yeah, it gets complicated. Janice, what do you think drives owner interest in these particular supplements?
So the dog aging project doesn't collect owner motivation data. So the owners aren't directly asked like why they're giving the supplements. But I think from some of the questions that we were able to ask, like the comparison amongst the disease processes, we know that dogs with certain conditions are more likely to receive certain supplements than others. And dogs with certain jobs are more likely to receive supplements. Like for example, agility dogs were more likely to be receiving supplements, especially daily supplements, than companion dogs were. Um, and then from the free text analysis, where when owners said like they're receiving some other kind of supplement, and we asked them, well, what is it? And they just type in. I was able to see that oftentimes the types of supplements and medications that are being given together. So like, for example, a dog might be receiving both heart supplements and medications at the same time. So it does seem like supplements are being given to help either, prevent or manage certain conditions.
And I think broadly, supplements offer owners a sense of agency, and that when a dog has a chronic condition or is diagnosed with something, supplements can feel like a proactive step on the owner's part. So even when the evidence for their use might be mixed or incomplete, I think it still gives them a sense of agency and a feeling like they're being proactive for their animal's health.
Yeah, definitely an important feeling. I know it's hard when you think you're like doing everything and you're like, what else can I do? Is there anything else? So definitely encourage if there's any owners listening to this to talk to your veterinarian before kind of going rogue and getting your own supplements to see if they have anything that they may recommend. So Janice, how does supplement use differ across life stages, such as puppies, adults, and senior dogs?
This one was so fun because it very much depended on the type of supplement. So joint supplements were more frequently given to older dogs, which if, older dogs may be more likely to have conditions like arthritis. So that kind of makes sense. Um, but for but it was still kind of wild that even puppies, like the amount of puppies that were reported to be receiving joint supplements was still pretty high. But like as life stage increased, so did the proportion that were on joint supplements. Um, Probiotics had the opposite trend. So the life stage that was most likely to be receiving probiotics was puppies, and then that decreased so that senior dogs were the least likely. And then omega-3 fatty acids didn't change at all across all life stages. It was like everybody, regardless of ages, is all receiving the same amount of omega-3 fatty acids.
Well, I fit into that demographic for my animals. Audrey, did the timing, in addition to the age of the animal, did the timing or purpose of the supplement seem to vary depending on the dog's health status, OA, kidney, skin?
Yeah, it did. So dogs that were reported by owners to be in poor overall health were more likely to be receiving supplements than dogs that were perceived to be in excellent health. And that pattern really suggests that supplement use is being reactive. It is a reactive use of them rather than something that's being used on the preventive side.
What do your findings suggest about how owners are making these decisions around supplements?
Well, as Janice mentioned, we don't collect information around motivation for those, and I think that it's really more suggestive in terms of thinking about owners being really deeply engaged and motivated to support their dog's health, and that supplement use might really reflect that they have concerns and cares and desire to do the right thing when it comes to the health of their animals. And again, those decisions are not always guided by veterinary input or strong evidence, which creates both challenges and opportunities for clinicians in the trenches.
So you've shared a lot of great information today, and I really want to kind of boil it down to like what the veterinarian can take home with them that might help them have a conversation with the client about supplements. So, Janice, how should veterinarians interpret these results when talking with clients?
So I think there's a couple things. For me, kind of personally, it was almost like a call to action when I was seeing a lot of the supplements in the free text that I had never heard of before. And so for me, it was like I need to look these up and see what they're being used for and look into research on their efficacy before even being able to have these discussions with clients.
Yeah, it's pretty dang hard to keep up, isn't it? And hard to find the evidence. A lot of it is quote behind the paywall on file. Uh, it's really tough. So, Janice, when a clinician is having these discussions, what are the main challenges?
Yeah, I think in that same vein, the biggest one is being able to understand the quality of evidence for a supplement, like being able to look into that research and understand, okay, what is it actually telling me, and then being able to then communicate that clearly, and two, making that, this is a supplement versus this is a medication, because that kind of came out in the data too, where a lot of times people were recording medications as supplements. And I don't want that to be a mistake that people make.
I think it's hard for me as a clinician when somebody would come up with a supplement or a different type of boot or something for their horse, and I'd never heard of it. And especially when I was younger, once I got a little more longer in the tooth, I was very comfortable saying, "I haven't heard that one. Can I see that? I would love to learn about it," or "Let me look at that," and or "What do you think about that?" And then to find out more what was, the perma muscle and the MSM and all the things that keep popping up. So I think it's important also to just say, I'm not aware of that. Let me look it up. Can you share that with me or send me a picture?"
So, speaking of research, and one of the things that we love talking about evidence. So, Janice, how does current scientific evidence align or not with the most commonly used supplements identified in this study?
So yeah, I feel like there's a lot of mixed feelings even in the research community about them. Like a 2022 meta-analysis in dogs and cats found no effect of glucosamine and chondroitin on joint disease, but there are significant limitations to a lot of the research surrounding glucosamine and chondroitin supplements. So, I still think that the jury's still out, and a lot more research does need to be done before we can truly make conclusions. And then on omega-3 fatty acids, it's also kind of hard because they're given for a wide variety of conditions. Like they are being given for everything, including joint, heart, skin, kidney, cognitive conditions, and the number of studies on omega 3s for each of those conditions can vary widely. So, yeah, it really more research that, the scientists say more research is needed.
Yeah, it's a tough one. What do you think in your practice and what your studies said are the most common misconceptions about supplements?
Yeah, for me, it's really the quality of evidence that we have for some of them. A lot of the studies that examine the efficacy of certain supplements are very small. And, I'll ask myself, do I really want to be making clinical recommendations based on a study of, X number of dogs? Like, how many patients am I going to be recommending this for? And how much do I actually understand about this supplement before I do so?
I think it's also the case that there's major misconceptions for dog owners, and that supplements seem to be considered inherently safe because they're considered a natural additive. And so I think that there is a bit of a confusion around the supplements and what types of levels of efficacy and safety we have in terms of the data that support their use. And then I think, as Janice mentioned earlier, owners in our study frequently were listing drugs as supplements and vice versa, which I think really highlights how unclear these categories can be from an owner's perspective, that those two things seem to be interchangeable for some dog owners. And I think that's something for us to be aware of.
And Janice, what gaps in knowledge does the study highlight?
I think for me, the free text analysis highlighted many supplements that have not been well studied. So like there were ones that I had never heard of prior to this study, actually, like bee pollen and some like dental powders. Like I was very familiar with dental chews, but I had never heard of dental powders being used as a supplement. Or perhaps supplements that I had heard of before, but that were perhaps being given for conditions I had never heard of them being used for. So yeah, I think there's a lot of room for future research into how these supplements are actually being used.
And we still don't know how supplement use affects long-term outcomes in our companion dogs. And so, or even which dogs benefit from which products. And so I think that that's something else that we really need to focus on, as well as Janice has mentioned earlier, those owner motivations and how those motivations really influence decision-making in this space.
Yeah, such important information. One final question for each of you. We'll start with Janice. What is one key takeaway you hope veterinarians or pet owners take away from your research?
I think for me, it is that thinking about the difference in between a supplement and a medication and keeping that difference clear. So that way, if we as veterinarians are making that recommendation, or if as a pet owner, you're feeding a supplement to your pet to maybe help manage a condition, but you're not seeing a huge clinical improvement, don't think that that's like the end of the road in managing that condition. Like you tried something and it didn't work, therefore we're all done. I think keeping the idea that there can be medications in mind is important.
Love it. Audrey?
I think for the veterinarian, the key takeaway is to make sure you're really asking the question and gathering history from pet owners about uses of medications, to make sure you're specifically including supplementation in those questions and trying to gather that information. And I think for pet owners, the takeaway is to talk to your vet about all medications and supplementations and supplements that you're giving to your pets, that they can record those and keep an eye out for long-term effects of those medications and supplements.
Yeah, thank you both. Really great information about considerations and important limitations to consider regarding supplement use. So thank you again for joining us. We love having you guys on the podcast. You always learn something from the Dog Aging Project data.
Thanks so much for having us.
Yeah, thank you.
And for our listeners and viewers, you can read Janice and Audrey's article on AJVR. I'm Sarah Wright here with Lisa Fortier. Be sure to tune in next week for another episode of Veterinary Vertex. And don't forget to leave us a rating and review on Apple Podcasts or wherever you listen.